So we recognize that there's a lot of information that we don't yet have as to how the kids with Krabbe are doing and their families as well. So it's important to gather that information, and the best way to do that is through development of a registry. So that's really been the focus of the grant that we've got, is to help put a registry in place. So in order to develop the registry, we need to develop data fields, decide what questions we want to ask, what information we really want to get to. And as we were putting this together, we learned that there was another institution that was interested in doing the same thing. So we're going to actually combine forces and try to do this in a multi-institutional way. So essentially, the registry is going to be set up so that people can join the registry electronically, like through the web. And then there'll be some survey-based questions and other information that we're going to gather and compile and be able to report on down the road. We've been very active in advocacy for Krabbe for a number of years, so we've been well aware of the Rosenau Foundation and their support in moving forward the treatment and understanding the biology of Krabbe. Well, so our family's had a medical bent, actually. So my father was a veterinarian, my mother was a nurse, and I was very interested in medicine as well. So I decided early on in my training that I liked the pediatricians better than some of the other groups, and so I decided to become a pediatrician. And then as I was training in pediatrics, I tended to gravitate towards the kids that were sicker and had more complicated issues. And so I went through hematology oncology training, and part of that is blood and marrow transplant training. Initially, we were taking care of the kids with leukemia and other types of issues too, but then I started doing just transplant and really started to focus on the rare disorders because I found that fascinating. I was interested in the genetics of some of these things. And the University of Minnesota had been kind of at the ground floor of exploring blood stem cell transplant for lysosomal disorders and peroxisomal disorders and some of these other rare diseases. So I became kind of very involved in that. And then it became quite clear that there was significant limitations associated with transplantation. And so we're interested in other types of therapies that might be evolving and coming down the pike as well, which may include gene therapy. So that's what I'm spending most of my time and effort focused on at this point. So really, in my clinic, all I really see are kids that have rare diseases that we're considering blood, stem cell, gene therapy for. Well, the University of Minnesota is kind of one of the initial groups that got started looking at transplantation for some of these rare diseases. And a lot of the lysosomal disorders were explored actually going back into the 80s. So, and Krabbe certainly was a piece of that. And it became clear that transplant may have been the best thing that we've had to offer, but there's a lot of limitations associated with that. And so again, whatever we can do to help kind of move the field forward and better treat the kids and better help the families is really what I'm here to do. Well, I think we're learning a lot more about the biology, and that opens the doors for us to be able to more effectively treat the kids. So that's one avenue that I think has ended up being really important. And the whole evolution of newborn screening is a tremendously big deal because we'll be able to, it's very clear that being able to intervene as early as we can makes a tremendous difference. And prior to the onset of newborn screening, unless there was an older sibling that was diagnosed, we generally didn't make a diagnosis in a child unless they were symptomatic. And by the time they were symptomatic, it's too late to do anything meaningful. So that has been a huge big deal, is to be able to look at newborn screening as a way of making a very rapid diagnosis and open up the door to treatment. Well, I think the best part of the job is being able to make a difference for the families. And sometimes we see these families that we've known for a long time, and their kids are active and living quality life and whatnot. That's a huge, big deal. In terms of things that have not gone quite as well as I would like them to, the development of new therapies and institution of new therapies takes a tremendously long time. And to devise a therapy, to test it, to organize a trial, to find the patients to treat on the trial, to follow them along and see how much difference these things are making and whatnot, and can take a tremendously long time. And so when there's new promising therapies available, not being able to roll them out expediently is an issue. But this is kind of the way that new therapies are tested, and those are the the guidelines essentially we have to deal with. Well, engaging the younger generation is tremendously important, and there's a tremendous amount left to learn and left to do, and there'll be many new therapies that are going to be coming down the pike that we'll have an opportunity to test. So the more we can engage people, at the high school level, college, medical school, or genetic counselors, or whatever avenue people decide to pursue, I think that's it's a very important area to recognize as one that's going to explode, I think, down the road, and there'll be a lot of opportunities. And I think a lot of it's going to be very rewarding. Yeah, I wish I'd better understood the obstacles towards trying to move things forward. So, getting grant funding is an important piece of it. People can have very interesting questions they want to pursue, but being able to find the resources to be able to explore these things is certainly one set of issues. And then again, the development of the clinical trials and being able to offer those is tremendously important. And there's a tremendous lot of progress in the gene therapy world, and I think that's going to be the answer for, or at least part of the answer for a lot of the patients down the road. But especially in a rare disease where there's not much impetus for some of the industry partners to get involved or maintain things. We've seen protocols go away because they're having a hard time enrolling patients, or there's one patient that does poorly, for instance, or whatever. So to see things that we'd like to see move forward get put on the back burner or eliminated entirely is, I think, really unfortunate. Well, I love to spend time with my family and friends and whatnot. We have a couple of golden retrievers that we work with, and they're lovely as well. I used to do a lot of stuff outdoors on the fishing side and those kind. I don't do as much of it as I'd kind of like to do. Starting to do a little bit of gardening here and there, but I'm not very good at it. And and I've been trying to learn how to brew some beers on the side too, but I'm not very good at that either. So, gives me something to grow into maybe.